Hi, I'm Dave Furnell, the editor of Diagnostic and Interventional Cardiology magazine. And here with me, John Carroll. He's the director of Interventional Cardiology at the University of Colorado. And I wanted to talk to him about transcatheter valve outcomes with the STS ACC TVT Registry. You've been involved with this registry since the get-go. And I wanted to find out a little bit, because it's very unique, how it got started, why, and where things are going with that.
Yes, well, it really got started through the collaboration of the then president of ACC, David Holmes, and the then president of STS, Michael Mack, and the head of the FDA device group, Bram Zuckerman, saying this is a transformative technology that is certainly in the early generation with very high-risk patients had potential for major complications. And here we were in the US, one of the last countries to have TAVR approved. So we wanted to roll out in the right way in the United States to maintain quality, but also to develop a learning machine of every patient who underwent this new procedure would have their data gathered, and that's where CMS became key, because part of their national coverage decision was, we're going to cover this, but we need to learn about it, and we need to continue to gather evidence, and that is a condition for it being covered for a hospital. So if you wanted to have your procedures paid for by Medicare, you had to be a participant in the registry. And that made the registry even stronger, because it was all the cases being used in the United States with these new technology. Secondly, the national coverage decision was written in a way that when new technologies got approved, they automatically could become their cases could be included in the registry. And that started to expand the vision of what this registry could do. Could we expand the indication of a particular device for patients rather than using these very expensive additional trials? And so one of the great stories was getting the SAPIEN valve approved for mitral valve and valve using registry-based information, because we were already using it, but in an off-label fashion. And often when things are used in an off-label fashion, no one's collecting the data. But the registry and the CMS required this, and so we were able to show in this group of patients who couldn't have redo mitral valve surgery that valve and valve was really a wonderful new approach. And so, yes, it helped the device manufacturer, but most importantly, it helped the patients, where now we got it approved and it could be used for these patients. And so that was part of the creativity of how we use registries beyond what is the very central and important aspect of quality improvement. Because we all, when we start programs, want to know how we're doing, and want to look at our results, but we also want a comparator. We wanted a national benchmark, and that's what TVT Registry has allowed in this rapidly expanding field.
So this is a unique registry, though, because I can't think of any other device areas where there's a required registry to put all of your patient data in for every case that you do with a particular type of device. And you had mentioned that this is helping accelerate transcatheter valves into the future. And where do you see this helping with the next generation of devices coming out?
I think it's accelerating our learning, and that has practical ramifications for all stakeholders: FDA, CMS, device companies, professional societies, and patients. We were able to develop some unique patient tools using TVT Registry, because obviously before a procedure, you can quote the statistics from a trial, but you want to know, okay, I have these certain characteristics as a patient. How well does this treatment go in people like me with COPD? And we were able to answer those questions using this this kind of data. So it's been it's a big effort. Sites have to gather a lot of data and input it into a national database, but it gives us a learning machine. We all learn when we do each patient, treat each patient. It kind of clicks into our experience and develops our gray hairs. TVT Registry does that for the whole country. We all contribute our data, we all learn from it, and hopefully we can advance the field and patient care much more rapidly by having this learning machine that is totally supported by the device companies, by FDA, by CMS and the professional societies and patient advocacy groups all working together. Because another major problem we wanted to address was the inefficiency of the US healthcare system in bringing new technologies, new therapies to our patients. And so this gave us an avenue to do that more efficiently and gave FDA a little more flexibility about approving new devices, knowing that immediately it would go into a registry gathering data so they could continue to look at safety issues, efficacy issues, and not just totally have to rely on the randomized clinical trial data of the binary decision approve, but the learning could go on.
And I think that maybe the last 3 or 4 years, there's been a late-breaking trial every year that has to do with this registry. And I think that might be a testament to the importance of it, because at ACC, at TCT, I see the STS ACC TVT Registry come up over and over again.
Yeah, and that's because often the index pivotal randomized trial really, through its inclusion and exclusion criteria, studies a fairly narrowly group of patients. But out in practice, we see a much broader spectrum of patients, and we need to learn, gee, does it work well there? Is it as safe for those patients over there? And that's the type of very patient-centric outcome-related data we can do. Secondly, we incorporated several unique aspects that weren't part of most clinical registry. So, number one, we wanted to get longer-term results, because it wasn't whether Mrs. Jones made it out of the hospital or not, but it was how well she was doing at 1 year, and how well was she doing in her own words. So that got into using the Kansas City questionnaire, the KCCQ, that looks at a patient's functionality, their quality of life from their standpoint, before and after. So we wanted to see, is she better? Is she able to do more in her own words? So those are the kind of unique things that we decided were key in this area to incorporate into in a registry.
And with the success of this registry, do you think that this is going to be the way of the future with new types of devices that are paradigm shifts in cardiology?
I think it makes sense because there's so much to learn about these new therapies. But we have to work on certain things like the efficiency of doing this, and there are a lot of data elements, and that's a big burden on sites. And so this goes into how do we improve electronic medical records so some of those data elements can be automatically transferred to a national registry rather than having to have someone go through an EMR and then put it into another database. So I think to really deliver the goods in these registries, we have to lower the cost of doing registry work and improve the efficiency of data collection and analysis.
Well, thank you very much for your time.